I'd say the biggest thing we're noticing here in the NICU is our census has gone up quite a bit. I mean, whether or not that was going to happen related to COVID or not is unclear, but we definitely have a significant increase in babies who are born to COVID positive mothers. Thus far, none of those recently have actually tested positive for COVID. We did have one baby about a year and a half ago when this all started who did actually test positive but had other complications related to the birth that may have been attributed to that. But as of late, we're seeing an increase of babies who are born prematurely solely due to the mothers, the adults, having complications with their COVID disease, and those babies prior to being born were showing no signs of distress as we would usually expect when we deliver or admit premature babies. I will just say that we're seeing premature babies having certain complications related to prematurity because they had to be delivered for usually respiratory declining status of the mother, and now some of those babies are showing or having complications of just being born early. Others are just sicker than we would expect. Like I said, we do have about 7 babies currently that have been born for those specific reasons due to maternal COVID disease. And there are various gestational ages, and they're all, when you relate them or match them up to equivalent gestational age babies, are definitely appearing to be sicker than we would have expected, even though they've all tested negative thus far for COVID, but they're showing certain complications that we don't usually see in those babies or haven't been seeing, and they're with us longer. And that's the biggest thing we're noticing, and it's obviously adding to our census, adding to the kind of just the overall stressful environment that it is for a parent to have a baby in the NICU, and now the parent has COVID and is separated from the baby in the NICU. And so we're kind of dealing with all sides of that, dealing with the mothers who are often sick and in the ICU themselves, and then they can't be around their babies. And if the dad's tested positive for COVID, they can't come into the NICU. So there's this separation of the family that we're also noticing, and that's having an effect on us, on the staff, obviously on the parents.